Hey guys, how are you? This is Dr. Kim. So let's take a look at this panoramic radiograph. This patient is 38 years old. From this, and if you look at the eruption status, you can see that lower third molars are impacted. They are mesially tipped, as you can see, and abutting the roots of the teeth that are in front, perhaps at the CJ level. I think what I want to show is that even though the image quality isn't necessarily the best, let me see if I can actually zoom in. Look at the distal surface of tooth number 18. You can see that there is a radiolucency just mesial to or anterior to where this impacted crown is located, right? So this is an example of a dental caries that's developed as a result of this impacted tooth and probably in a prolonged accumulation of food and plaque and such at this site. And this is relatively common when the tooth is partially perhaps erupted and then it's partially erupted and impacted in such a manner that the food can easily be impacted or dislodged underneath, and then that can cause the decay or decalcification of the tooth. Because this area, as you might imagine, is very difficult to clean because of impaction. So that tooth needs to be really removed. Thankfully, from as best as I can see, the root apices appear to be away from the mandibular canal, so that should be helpful. I think one more thing that I wanted to mention is that you're seeing that there's a radiolucency in this area, right? And that's a little bit more pronounced than the contralateral side. But if I adjust my contrast quite a bit, you can actually start to see the bone patterns in this area. And this type of appearance may be more common because of the particular panoramic unit that we have at our school. But whenever there is a significant or severe concavity along the arch, and most often that's typically in the area of lateral incisors and canine, and sometimes it extends into even premolars. And obviously, the way the patient is positioned, it can create this radiolucent appearance. And if you're not used to that, seeing this, it could appear as if there's an osseous defect. So I want you to note that this is not a true defect, but rather it's more of a positional error in how the image is created by our particular panoramic unit. Before I finish, another thing that I can point out is that below the roots of these molars, you're going to see relatively a straight radio-opaque line. And you may be wondering what that is, or perhaps you never noticed that because your eyes just got accustomed to seeing that, right? Sometimes you don't always nitpick and figure out what each of these landmarks represent. So this is actually a ghost image of the mandible. This whole area, you're looking at the inferior border of this mandible, and that is the ghost image of the opposite mandible, okay, the left side. Alrighty, that's all I wanted to say for this video, and I'll see you in the next video. Thank you very much for your attention.